Good morning, this is your newscast, Current Mexico, and I'm your presenter, Alexia Villegas. The topic that we are going to talk about today is how the tourism sector in Mexico has been affected by the COVID-19 pandemic. As we all know, one of the highest economic income for Mexico is in the tourism sector, and one of the most important branches of this sector is the religious tourism. According to the UNWOT, Mexico is among the 10 countries with the highest demand for this type of tourism, which has been affected by the lack of visitors for the activities that were already planned. The trips that were planned for these activities have left a spill of 10 billion pesos. According to José Manuel López Campos, the economic impact for these activities and this sector is so far incalculable. Now let the expert in economics, Arturo Galicia, tell us how we see it affecting the global level of the economy of the medical emergency presented by COVID-19.
Thanks, Alexia. And talking about economy, most likely we will not get a precise number even for that. A first guess is that the death toll, at least for this year, could be similar to the one of 2009 swine flu pandemic. There is a little doubt about if the pandemic will result in a very large cut in international trade as well for falling global demand, both for consumption as well for investment. But also income losses are expected to exceed the 220 billion in developing countries. This may be further exacerbated by a spike in cases, as up to the 75% of people in least developed countries lack access to soap and water. A UNDP-led COVID-19 rapid response facility has already been launched, funded by existing resources and capitalized with an initial of $20 million. This facility is disbursing throughout a fast-track mechanism, enabling UNDP teams to offer immediate assistance to countries for their national response. UNDP anticipates a minimum of 500 million need to support 100 countries. And that's all talking about economy. Thanks, Alexia, and coming back with you.
We also have the expert Alexander Cano, who is going to tell us how the medical emergency is affecting the tourism sector in Mexico and a few proposals for the companies to lessen the situation and how to be prepared for a similar situation in the future.
Good morning, everyone. We all know that the COVID-19 pandemic has had effects throughout the world in various economic industries. However, the tourism sector is one of the most affected worldwide, as highlighted by the Secretary of Tourism of Sinaloa, Oscar Perez Barrios. The closure of beaches and hotels responds to the intention of being able to administer and control the importation of cases from other entities. Since the Secretary stressed that during Easter last year 2 million visitors attended Sinaloa to enjoy its beaches, unfortunately, the contagion curve coincided with Easter this year, so the authorities are now focused on avoiding conglomeration of people by closing beaches, resorts, and attractions as well. On the eve of the Easter holidays, the country's tourism sector is experiencing one of its worst debacles due to the coronavirus epidemic. In these situations, all companies must have an immediate response team, analyze past events that have affected the sector in which they operate in order to have an action plan regarding certain situations. Also, generate instances of coordination of the agencies for the promotion of innovation and scientific research, as well as establish lines of financing that support the expansion of enterprises and technological solutions from one country to another. Thanks, Alexia. Coming back to you.
And finally, we have the expert Luis Enrique Rodriguez, who is gonna talk about a few proposals of fiscal and monetary policies that we can implement to be able to correct the effects generated by this pandemic.
The two main proposals of our government to fight this crisis is the monetary transfer to people over 18 years old. In Mexico in 2019, 56.2% of the economic active population was working on informal jobs, equivalent to 31.3% the million of people. Due to this, it's important to think about the basic income of a family. For this, an individual monetary transfer plan will be implemented for 3 months. Also, another proposal of our government is to increase the budget for the healthcare. The primary action in the fight against the COVID-19 crisis is to focus to increase the quality of the healthcare. The two main purposes of this action is to guarantee access to diagnosis and treatment for all. Also, is to boost and optimize the capacity of the health system.